the largest, most successful, and arguably most influential pregnancy resource center in America. That and a lot more on this episode of All Things Women's Health. I'm an obstetrician-gynecologist of more than 30 years. I'm a husband, I'm a father, I'm a grandfather, I'm a small business owner, I'm a Catholic, I'm a lot of things. But right now, I'm your host as we talk about, really, all things women's health. It doesn't matter if it's menstrual problems to migraines, mammograms to menopause, homeschooling curriculums to personal trainers. If it affects women, it's on our agenda. And on our agenda today, as I mentioned, is Pregnancy Resource Center. And not just any Pregnancy Resource Center, but realistically, one of the largest, most successful, most influential pregnancy resource centers in the country, the Women's Care Center. We're going to talk to one of the very early founding members of the Women's Care Center and a VIP in all manners, life and Women's Care Center, Anne Koehl. Anne, thanks so much for joining us.
Well, thank you for having me. Not so famous.
Anybody that knows you, and most everybody does know you, you know what they're thinking right now. How did he talk her into doing that?
Yeah, they sure are.
They know that you would rather not be in front. You are always behind the Women's Care Center.
Yeah, my preference.
but the reality is there'd be no Women's Care Center without you.
Oh, you're very kind.
So we talk about the Women's Care Center like everybody knows everything about it because it's a big part of our world, but not everybody knows that.
Right.
So maybe a good way for us to start would be you to go back to the beginning and tell viewers, what is this thing called the Women's Care Center?
The Women's Care Center is wonderful. Founded in 1984, Professor Janet Smith was at the University of Notre Dame. And she heard that an abortion clinic had opened in South Bend and was concerned because students were starting to talk about it. So she went to St. Joe Hospital in South Bend and asked if they might have a little space that she could have to talk with women. They happened to have a little blue house right next door to the abortion clinic.
Wow.
So that's how we started.
Wow. And then, to pause a minute, that's the Janet Smith.
The Janet Smith, Professor Janet
You're
Smith.
right, that a lot of people may not realize him. She was a very famous law professor at Notre Dame. She got a little sideways, I think, as the story goes, with Notre Dame, and has been at Boston College since then,
She was
right?
at U of D, University of Dallas from Notre Dame, and then Sacred Heart Seminary in Detroit.
Maybe that's what I'm thinking, not Boston College.
Yeah.
I'm thinking of Peter Kraft.
Yes.
But, I see her all of the time on the speaker circuit. I see her on social media.
Yeah.
So she's...
We have a very famous foundress.
a very storied past. But I think I had forgotten that she was responsible in those early days. So we set up a little house next to an abortion clinic.
We did, and she saw 300 women the first year.
Was that part of a well-thought-out strategy? Let's position ourselves right next to an abortion clinic.
Not necessarily. Actually, the hospital did it for her.
Wow.
But we found that was a wonderful place to be.
Yeah.
She saw 300 women the first year. And she realized that counseling was the issue. They really needed to have someone to talk to them. So she raised $30,000 for a counselor, a well-prepared counselor, and went with that.
Wow.
And so things have developed, of course, since then. We've gotten a little bigger and a little a few more programs, but that's how she started. So we always look for a location near an abortion clinic when we can. Now, Indiana, we're in good shape now.
There's no more abortion clinics.
Right.
Now, how did they get from the little blue house to where we are now?
Right. So a little bit of time developed. Anne Mannion, our volunteer president today, was one on her board, her original board.
Wow.
And so when Janet was transferred, or when Janet made the move to University of Dallas, Anne stepped in.
Wow.
And to this day, she's our volunteer president. So she had the vision for the buildings. This little house was a little blue house, maybe 600 square feet.
Wow.
Needed probably help. So, that's I'm a few years later than that, but they just decided, and I totally agreed. The clients deserve something really nice, and they're coming a lot of times from a life that isn't so nice. So I've only known Women's Care Center to be beautiful, lovely buildings, very home-like. So we don't have a reception desk. We don't have, they don't sign into paperwork right away.
Yeah.
We don't wear scrubs. We just wear street clothes. And
Do you know, was that part of a vision way
yes,
back?
yes.
And I wonder what some of those early conversations were like, because the 80s were a tough time for
Right.
abortion
Right.
everywhere, not just in Indiana. But I wonder what some of those early strategic discussions were like.
Oh, yeah. I would have loved to be part of those because I was working here with the Nurses Concerned for Life, and I know what was going on here. But yeah, I don't know. I guess I don't have the complete history on how we moved to that, but I just know that Anne had this strong sense that we want really nice buildings. What I know about Fort Wayne is we were next door to the original abortion clinic on Webster Street when we started, and we made this 1910 building look beautiful. It was a gray cinder block building when we got possession of it, and we made it look beautiful because the abortion clinic was so opposite, so poorly maintained. They didn't even grow grass on their lot. It just looked awful.
So a stark comparison.
Yeah. And so what we've noticed, what they had already noticed for many years that I noticed immediately was the women hope their care's in our place because it looks nice. It looks inviting. It looks like someone cared for them.
Not
so they hoped it
clinical.
was in our care. So in the first year, we had 77 women in the wrong door, believing they were at the abortion clinic, hoping their care was in that building.
Wow.
But when we have an opportunity to talk to them and just have them take a moment, it's just amazing what can happen.
Maybe let's talk about Women's Care Center from a 10,000-foot level. So viewers may be surprised to learn it's not just in Fort Wayne. It's not just in South Bend.
Right.
This is a big organization, but
Right.
give us a sense of all of that, how it
Yeah.
works, what states, everything.
Sure. So we have 37 centers now in 12 states. And Anne Mannion and I have a running little joke because when I went and begged her to come to Fort Wayne, she said, "Oh, I don't know," because at that time we were just in the South Bend corner of the world. She goes, "I don't know, you're 2 hours away." And now we're in Fort Pierce, Florida.
Wow.
So
And Chicago.
And Chicago, yeah.
Downtown
Chicago's big.
Chicago.
Chicago's good. They are busy. In our journal where we do our scheduling and such, red indicates an abortion-minded woman, and their schedule is almost completely red every day. So they've got a lot. It's huge, though. I think they have 7 counseling rooms and 3 ultrasound rooms going. Wow. So they're busy. Thank goodness.
So if someone visited a Women's Care Center in South Bend and then they visited in Florida, would it feel the same? I mean, is it a Starbucks in a sense that it's kind of franchise feeling that's pretty consistent?
Right. Yeah, they would. So, we have couches and love seats and chairs just like you would at home. We want the home-like atmosphere, and that's what Janet started in 1984. She wanted it to be home-like and natural so that they felt like they were talking to a mom or a sister or grandma that wanted to help them.
Right.
And so, yeah, we're going to be like, now Florida is a little bit different. It's going to have a little bit of a Florida flavor to it, But for the most part, Anne does our decorating now, and she's just become fabulous at it. So my center at West Jefferson might look like the one in Milwaukee right now, but,
Sure.
clients are not going to pass by both places,
Right.
probably. So,
But operations and feel and philosophy is the same in all of them.
all the training occurs in a training site, generally South Bend, Indianapolis, or Indianapolis. And our binder, we have a thick binder, and everyone that wants to work for Women's Care Center will have to accommodate that. Training is 4 weeks in one of the training sites. So we are all on the same page. And there's hundreds of us now.
So, I think a lot of viewers probably have an idea, and we should probably start off by saying it's not called a pregnancy crisis center.
Right.
Why not? That's a logical name. Why is it not called that?
It's very logical because there's certainly crises. However, we want to always maintain a sense of it's going to be okay. We're going to be able to help you. This is a place to come for resources. And so that changed probably 30 years ago. The group, the Nurses Concerned for Life here in Fort Wayne, the original group I helped, was a crisis pregnancy center because everywhere in the country after Roe was a crisis pregnancy center because this was a crisis. But we learned to tone that down a little bit and make them feel more comfortable and
Because
more
if we do
confident.
things right, it won't be a crisis.
Exactly. Exactly.
So it's a pregnancy resource center.
Yes. Mhm.
So what's a typical phone call like? Why does someone call a Women's Care Center?
For the most part, they call because they think they may be pregnant and they'd like to have a test. And they have heard 42% of our clients come by word of mouth of a friend or someone who's been there. So they hear that we will do free pregnancy tests. Free is always good. And then we'll schedule them. Sometimes they tell us ahead of time what they're thinking. Other times they just want a pregnancy test. Yeah. And then when they come in, we learn a lot more about them and then what their objective is.
Yeah.
So that we go from there. But most of the time it's just, I'd like to have a test. And we see them at 3+ weeks sometimes.
Yeah.
4, whenever we can get a positive test. Most of the time they've done a home test, so they suspect.
So I meant to ask you that. So you're not talking about just a simple Aldi store urine test. You actually do serum blood testing.
We don't do serum blood testing, but we do medical grade.
Oh,
we do the same
right.
thing as a hospital.
That's
Yeah,
right. That's what I meant. Yeah, not serum. Yeah.
So yeah, it's it's.
But
for
then
real.
you offer them next an ultrasound,
Right.
which is also at no charge.
At no charge. There's never a charge for any client at the Women's Care Center. Ultrasound is huge. Such a wonderful new thing when I went to a Women's Care Center because Nurses Concerned for Life did not have ultrasound at all. So this was just amazing, and I could see immediately how important that was going to be. So
Pregnancy is so abstract.
Yes.
And until you see that picture, and then it suddenly becomes a lot less abstract.
Right.
So, they'll get a test. Yes, you are in fact pregnant. And then an ultrasound to say, in fact, this is how far along you are, or this is your due date. What happens after that in a typical encounter?
Actually, what happens first is the test and then the counseling piece. So we'll do an intake with them. And again, we try not to, I don't work with a board and take information, I work like this and chat with them. And when they tell me something that I might not remember in an hour, I just take a note real quick. But we want to know what their situation is. Where do they live? Who do they live with? Who's supporting them? Who might not be supporting them that is important to them?
Oh, sure.
Do they have insurance yet? The common things that we're going to need to figure out. Do they have a doctor yet? So we just want to get to know them, but it's all strengths-based counseling. So we're going to listen all the time. I had a perfect example a few years ago of a woman who came in and she was going to abort because she was in the middle of school. It was accounting and it was a lot. And she thought the biggest problem was she didn't have a babysitter.
Oh, my.
And it's just amazing the issues that just overwhelm them. Now, she's overwhelmed, period, but that was the issue.
Yeah.
And so as we were talking, she happened to mention that not having a sitter was a real big issue for her. And then later in the conversation, I stored that away. And then later in the conversation, she was telling me for some reason about her grandma. And her grandma was just the best. And she was so able and so young at heart. And she was going to retire. And I tucked that away. And then when we got back to, I'm going to have an abortion, I said, you were worried about who would watch the baby. I wonder if grandma would. And it was just like, oh. So I bet she would. So it can be something so simple. Child care is not simple these days, but it can be something so simple that was driving her.
An obstacle that easily overcome.
Yes.
Maybe the crisis caused you not to think about it.
Right. And
it's
so I
interesting,
listen.
You use the word counseling, which I think, viewers could think, counseling, what do you mean? You don't like your mother from when you were a teenager?
Right.
But you're really talking about really a conversation.
It is a conversation.
Tell me about you.
Yeah.
Tell me about your life.
Right. It is a
the
conversation.
good, the bad, what's happening.
Mm-hmm.
And
Absolutely.
then as you get that information, you start processing that with the goal to provide help.
Right. And to take away some of the fears that are not really there, the fears are there, but there's answers. There's the answers if we just can listen enough. So a lot of our work is just listening.
Wow.
Listening to what the issues are for them.
So the woman would go through that process and keep going with
And then we will give her, after we've talked with her. If abortion is on her mind, we will give her abortion information with her permission. So we will tell her what to expect because they don't know. It is so common for them to say, I just want to get that pill because it'll be over easy, it'll be quick, easy. They've got a whole notion about the pill that's just not right, the chemical abortion that's
I think it's
just not
I'll
accurate.
bet people are shocked to learn that you give them information about abortion.
Yes,
I think we would be accused of pretending like it didn't exist, but
Right.
you're actually giving them real information
real information.
about it.
Yeah, what they would expect, how that's going to play out. Luckily, in Indiana now, there aren't so many abortions, but 2 hours away in Ohio, Michigan, yeah.
And
they
there
can
is
get
this
one.
pesky thing called the internet.
Right.
Right.
Yeah. So,
Interesting.
so we will explain the procedures to them because they do not have any idea of what that means for them. They don't know about complications. They don't know about the risks. They don't know about fertility risks afterwards. There's just so much. So we'll go through all of that. We always tell them there's 3 options. Well, you have 3 options. First is parenting, and you've been parented, so you know what that means. Second is an abortion, and I'm happy to tell you about that. So with their permission, but they all want to know. Hardly anyone turns me down. Very, very occasionally, someone will say, I saw it on the internet. I don't need to know. But that is super rare. Most of the time, I better know. I better know what this might be about, so it's great. And then the third is adoption. And our children are all adopted. And so I love it when I can get in that conversation. And I always tell them I wouldn't have a family if it wasn't for a brave woman like you that gave me your baby to raise. So
you have that conversation, and what happens after that?
then we'll get the test results to her. So then that's another whole conversation. Sometimes they haven't let on to me what their true intentions were. We might go on and they indicate they're going to have the baby. The results are the real McCoy.
Yeah, it's
so to
not
speak.
theoretical anymore.
No, it's for real by then. And so then they may say, oh gosh, I was considering an abortion. So then we may have to have that conversation at that point, whatever it takes. But we're going to head to ultrasound. That is our goal. We almost always do same day ultrasounds. If a woman comes in and she's happy parenting and it's very clear, maybe she's got 2 children, they're really happy, they planned on it, married, everything seems good to her. We might, if she's only 4 weeks, we might
postpone that
a little bit.
Yeah.
So we say happy parenting. We'll see them at 7 weeks or so. But an AO, an abortion-minded woman, will do same day always.
So for the woman who's not abortion minded, I guess that's a separate body of work. I'm pregnant now. Here's an ultrasound. I think personally, a lot of viewers would be shocked to learn that's not where things stop with the Women's Care Center.
No.
So she's going to get connected with some kind of medical provider for traditional pregnancy care.
Right.
But if things go according to plan, she stays connected with you at the Women's Care Center. Why? What happens there?
Well, because she's going to, if she needs her insurance, 93% of our clients need Medicaid government insurance. So I have a Medicaid navigator that comes twice a week now to get them insured. And then we give them a doctor's list and a few good referrals that we believe in. And then they're invited to parenting class and they're invited to birth preparation, especially first-time mom. We're going to encourage birth preparation, which is a series of classes we do. Early on, we're going to do nutrition and morning sickness helps. Then we'll get into labor and delivery care of their newborn. We've been a little surprised on the younger women today. They haven't had much experience with a baby. And I think smaller families, where I was...
Compared to maybe a generation ago.
Yeah, I'm the oldest of 8, and I was changing diapers fairly early.
Right.
And often. And so they don't have that experience.
Oh, that's interesting.
Yeah, and they don't seem to babysit. But I know as a grandma, I'm the babysitter these days. I used to pay babysitters to help us, but I'm the babysitter for my grandkids. So they don't seem to have that experience.
So there's a cultural missing piece
there. There is a missing piece there for sure. So we have life-size baby dolls, and we'll teach them how to diaper, swaddle. We'll take them to the sink and show them how to do a sink bath for a new young baby. So whatever they need, basically whatever they need. So it could be up to 10 sessions throughout the pregnancy. Parenting class, they can come every week. We have 3 classes in English and 1 in Spanish every week. So they can come to parenting class right away and all the time. And everything's attached to a coupon incentive program. So they get coupons whenever
For
they meet
attending.
with us for attending.
So not only are all of these classes, which are phenomenal, they're free.
Yeah.
But not only are they free, they get extra bonus by just coming.
Right.
The coupon system.
Right, the coupon system. So, and they love it. They could earn anything from diapers every week. Some moms just plan on diapers every week to their crib and mattress, stroller combo. There's anything. We try and
And there's
spread the
baby
figure.
clothes.
Oh,
There's a
baby
lot of
clothes,
things.
diapers. Yep,
Books.
everything you need.
Yeah.
Books. Yes, we have. We learned right away and that they don't have the disposable income, and reading is so important for the children. So we have a book bin in all the centers, and mom can take a book for every child every time she visits. So I think we've used 1,600 already this year.
Another incentive.
Yeah.
And all of which, I sound like a broken record, all of which is at no charge at all.
All of which is at no charge.
And then so the mom progresses through her pregnancy care in a traditional provider sense. She's progressing through sort of parenting, childbearing preparation with you. She has her baby, but that doesn't stop.
No.
There's more women's care centers.
There's more. She can come to parenting class forever. So we say we're cradle to kindergarten because by that time they're on the way pretty much. But I have moms who come back. We have a mom right now that had her fourth baby, 3 of them with us, and she always took a round of parenting class and pretty much got through diaper time. And then she'll have another baby, and then she'll come back and do it again, and it's all good.
How common is it for, a woman that walks in the door, for her to become one of those that marches through that whole process that we just described?
Good question. I don't know percentage-wise. Not a lot. We see, so far this year, we've seen 1,300 women. So obviously 1,300 women wouldn't fit at parenting class every day.
Right.
But a lot of women just want their tests. They love the ultrasound. They're happy parenting. They're fine, so they won't come back. So we get a lot of company wanting the ultrasound.
Oh, I'm sure.
Free ultrasound is quite the hit. But otherwise, maybe 10%. We have about 100 women a week. That's probably right. About 100 women a week in the classes. We started an ESL class for coupons as well because we have fairly large Burmese population.
Sure.
And it's really hard to find Burmese translators. It's almost impossible to find a Burmese teacher for parenting class. So they were missing the coupons, and that was harmful for them, hurtful for them. So we started an ESL class, English as a Second Language class, and we give them coupons for that.
Wow.
So they can still shop.
So there's kind of that tract that we're describing, but there is the other tract. So you see someone, maybe she openly says, I'm interested in abortion. You tell me about it, and I think, that interests me. I think I'll go pursue that. How does your relationship change, or does it at that point?
If they go forward, that is such an interesting part of our work because that will happen. We never want to be judgmental, of course, but that will happen. That she'll take the course of care. She'll have a couple ultrasounds, find a beating heart, and say, okay, well, good, then I need to do this.
Yeah.
It is so hard for us to deal with that.
Yeah.
But amazingly enough, she'll come back. And so I think my counselors are just so great at not judging. She didn't feel judged enough about her decision that she would never come back and see us again.
Yeah.
So they'll come back.
Wow.
Most of the time, almost 100% of the time, they're very sorry they did that. It was a decision that was very crippling for them. And they want to do something different. Very, very rarely someone will come back and they had it. It was great, no problem. And they want to probably plan for that again. So that's really, really hard. I know that for some women, there's relief. The initial part of the abortion procedure is that there's relief.
This situation is over, or at least this part of the situation's over.
Right. And they don't look forward. They don't look toward any grief, any psychological problems.
Yeah.
And I've read a couple places that some of that won't happen until they're out of their childbearing years.
Oh.
And then the sorrow is much greater because they wasted that time or they interrupted that time. So we don't always see terrific sorrow. We see more relief probably than sorrow. But almost everyone who's had an abortion that returns no one says it was a good experience.
You know, it interests me when I hear you say that. I can't give a statistic, but I would say it is very common when I'm seeing someone with a fertility challenge. But that's how I spend most of my energy. And we're going through their history and we're talking about the possible causes and this and that. And it is very clear talking that there's something else. And of course, I'm thinking there was probably sexual abuse or there's some other topic, which is very common.
Yes.
But the thing that always pops up when it feels like there's something else is there was an abortion.
Right.
And if she's sitting with her husband, in many cases, he had no idea.
Not him.
And I've just pulled the scab off maybe a 25 or a 30-year wound.
Right.
And they're devastated.
Yeah.
I've never seen anyone celebrate the fact that when I was 18, I had an abortion.
Right. No.
There's always trauma there.
There's always trauma.
You don't
And
hear
we
that
tell them about what the risks are for fertility.
Yeah.
I mean, that's a big part of my story with them. Is,
Yeah.
you know, there's a lot of risk here you want to know about.
Yeah, the feelings that I hear conveyed is, you know, I was pregnant. I destroyed that pregnancy. Now I desperately want to be, and I can't be.
Yeah.
Look what I gave up.
Right, yeah.
Where would I be if I hadn't given that up?
Right. And the losses, especially after surgical, which we don't see as many surgicals, but after surgical and the cervix damage, they're having losses.
Yeah.
So they
And
chose
no one
abortion.
talks about that.
No
It's a
one
secret.
talks about that. It is big secret.
Yeah.
But they're having 2 or 3 losses, and
Yeah.
they know.
Well, because you have such insight into an area of life, that's not a pun, an area of life that most people never do, but give viewers a sense of the, I guess, circumstances, you might say, that you learn about that a woman thinks abortion is the best option here. This is logical. This makes sense. I'm going to do an abortion.
Right. It can be anything. Often it is shame. They're too young to have a baby. They're not married yet. Sometimes, you know, it's unfaithfulness in a marriage.
Sure.
So there's a lot of really tough circumstances for them. Sometimes it's no job. I think 33% of our clients are unemployed.
Right.
63% are single. So that makes that is a problem all by itself because they don't have the sturdiness of a relationship.
I think it's easy to sort of demonize the woman that finds herself in that position from the outside looking in, to think, how could you? And I know in my own 30 years of practice, it never stops amazing me. When you hear a woman describe, this seems like a good choice, or among all the bad choices I have, this seems like the worst one. And I can see a young woman's face not too many years ago that, you know, she had a few children. She was living with a man who was not the father of those children. She was not working, financially destitute, and she became pregnant, not with the man she was living with.
Correct.
And she's describing this to me, and she said, you know, you don't understand, and she's right, I didn't. You don't understand, if he learns that I'm pregnant, we're on the street. If we're on the street, I can't feed my kids.
Right. Absolutely.
And I think most people, it's just impossible to imagine what that would feel like. I like to say, women don't choose abortion, it chooses them.
Yeah.
I mean, she had to be in such just desperation to think that could be the better way.
Right. A woman, a younger woman, probably still living with mom and dad, and she's had a baby, and they say never again.
And then again.
And that's in her mind when she finds out it is again.
Yeah.
So there's a million reasons, you know, for them to.
I know it exists, but I've never seen it as a casual decision, which is what you see on the news and on social media.
Oh, yeah.
You know, I decided I was going to have chicken, I was going to have steak, I was going to have an abortion, as though it was just a meaningless decision.
Yeah.
I've never witnessed that.
No, we do not see that. Very, very rarely someone seems that way, but by the time we're done, it's not that way. By the time we get to ultrasound, often, you know, they're very confident. They're very absolutely confident. And then we do an ultrasound, they said, oh, well, I didn't think I would hear a heartbeat.
What do you think is going on in the mind and the heart of the woman at that point?
I think she thinks, boy, did I have this wrong. I had the sweetest girl years ago now, but in the course of counseling, we will tell them also describe fetal development to them because
Sure.
they need to know.
Yeah.
They will they will often say, "I want to get this done before it's a baby." I say, "Oh,
Oh.
sorry, already is."
And that's the personhood argument,
Yeah,
isn't it?
exactly.
Yeah,
exactly.
if you're able to dehumanize something, we're capable of amazing atrocities. Look at
Yes.
concentration camps and the like.
Right.
But
right.
if you humanize this,
Yeah.
which is the truth,
Right. Right.
it does change.
It does. So we talked about. I know she said she wanted to get it done before it was a baby. Wanted to get it done before there was a heartbeat. And then at least 2 other times, probably in my fetal development talk, at least 2 times we talked about baby having a heartbeat. We get to ultrasound. I put the probe down.
Yeah.
We got a great heartbeat. She goes, wait, it's got a heartbeat?
Oh,
yes, it does.
Wow.
So the 2 have to work together because once she has a heartbeat, then she'll probably remember the other things we talked about.
I think the ultrasound is a magical tool. I mean, even in non-abortion minded people, I've seen men who just don't seem to respond to this idea of pregnancy. It is very abstract. Your wife looks the same.
Yeah.
Everything is the same, but she's telling you this stuff. But then on the ultrasound, you see there is a tiny human inside of her. It's real.
Yeah.
But, on the abortion-minded woman, when she sees the baby on the ultrasound, my theory has always been that she is experiencing something that as a man I will never know and never even be able to really conceptualize, but that is, there is a human life within me.
Yeah, it's just such a stark moment, and it's such a wonderful moment. And that is honestly why 98% of our women choose life.
98%.
We're at 98% right now. We always hope for the best. In the whole Women's Care Center, we're 93%. But a lot of areas of the country have a much higher percentage of abortion-minded women.
Oh.
Just Indiana's pretty conservative,
Sure.
So your parents
cultural
are probably
differences.
yes.
That's interesting.
But yeah, we're at 98%, and I give a lot of credit to my counselors, but I give a lot of credit to ultrasound because it can be over then. And the dad crying, it's like what, and he may have been the push to abort.
Oh, of
we never
course.
know,
Right.
for sure.
Yeah.
But so it's wonderful. I'm so grateful we can have that tool these days.
Yeah. I mean, it is fascinating because I'm sure you can make, that couple can make this long list of all of the horrible things about being pregnant. And then all of a sudden, all of those things that just seemed like a crisis, suddenly now there's a child and you think, I guess we could work through those things.
Yeah. No, it's wonderful. It's so, and the other thing I think in counseling that's important in the counseling part is I very early on, if abortion is on their mind, will say, I know this is your decision to make. I totally have that because that just wipes away this old lady is going to talk me out of what I want to do. So I think it's really important too that, and it is, honestly, it is. That's the truth. But I think, we try and make the centers, we try to plan the centers carefully so we don't have babies all over. We try and make it so they won't have the sense that if I go in here, this is all they're going to talk about. And I think it's really important to set that aside.
I wish we could get this on CNN because I know people that would call themselves pro-choice drive by a women's care center and they think, oh, that's a brainwashing place. You're going to go in there and they're going to trick you.
Yes.
And they'll have pictures of beautiful fat babies everywhere and they'll try to guilt you into keeping your child. And if you think that, go visit a women's care center. Just walk in. They'll be happy to greet you.
Yeah.
Nothing could be further from the truth. It is it's incredibly non-threatening and welcoming.
Yeah, good. Yeah, that's the whole point. If they feel welcomed and if they feel that they can tell their story and not be judged, we're going to make progress. We're going to make great progress.
And that's not a lot. I mean, that doesn't take a lot, does it?
No.
I mean, it takes somebody willing to do that.
Yeah.
I think it works so well because if you just tell the truth and get rid of the myths and eliminate the lies that the devil is in their ear,
Yeah.
suddenly life wins.
Right.
But you have to get to the truth.
You've got to get to the truth.
And it's increasingly difficult to get to, I think.
It is. It is.
Wow.
It's been a lot, but
So
we're blessed.
You've been doing this a long time.
Yeah.
When did you start with Women's Care Center?
In 2002, John Pop approached me about finding something to go into the building that he bought next to the abortion clinic. And he bought it. He just bought that building, and that's what he wanted. And so
Now, who is this John Pop fellow?
he was the Sunbeam Bakery guy in Fort Wayne, Indiana. And I knew him as a pro-life advocate, through a lot of stuff. He was real politically involved, but so he bought this house and just in faith. And so I went to South Bend like I thought I was somebody and asked. And Manny, because of today's Catholic, I knew about Women's Care Center, and because that was my interest since nurses training, I knew about the Women's Care Center. So I went to South Bend and asked if she would come to Fort Wayne.
Wow.
So
How did you, as a nurse, get so interested in abortion as a topic?
Well, when I was in nurses training, good old St. Joe Hospital, I happened to be in my OB rotation the day Roe came down.
Oh.
And, in those days, there wasn't really NICU. We just did the best we could. If a baby was early, we loved them and cared for them the best we could. But, their chances were much slimmer than they are today.
Yeah.
And I just watched these nurses that were training me just take such great care of these babies. And I came from a large family, great parents, knew life was always welcome. So I had that sense. But when I watched them, they worked so hard. And Roe happened, and that night I wrote a 7-page letter to the Supreme Court. Like, who cared? But I did.
Yeah.
Because I could not understand, I think I was 19 or 20, how a group of men in Washington, D.C. could decide that those babies didn't deserve to live.
Wow.
And I couldn't
Wow.
get away from it. And then I met Phyllis Avila and Phyllis Morgan, who were the pioneers in the pro-life ministry here with Nurses Concerned for Life, and became involved with them.
I mean, you really made a career deviation at that point, right?
Right. Yeah, that's what I mean. In the meantime, I was a med-surg nurse in Peru, Indiana, but I was just always aware of and wanting to be part of the life issue.
Wow.
And then when we realized we were infertile and adoption would be our plan, I hoped that women would not continue to make those decisions so that we couldn't have a family. Wow. So God just sent me on the path. And then I was home for 26 years baking cookies with babies, and they asked me to be the director, so that was amazing.
That's remarkable. That's a great story.
I'm so blessed.
I meant to mention this a little bit earlier, but how does the Women's Care Center work? And when I say that, I mean financially.
Financially, yeah. Well, we're donor-driven.
Because everything is free.
Yes, everything's free, right? And we have the boutiques also in all the stores where the women shop with their coupons. Yeah. So luckily we're very blessed to have the care of the Christ Child Society, another not-for-profit in town that helps us with that. Yeah. So that's huge because I think only 3 of us have a Christ Child Society in our town.
3 centers.
3 centers, 3 among the country, I think maybe in Wisconsin. But so we're very blessed by their care for us, and they provide all the clothing pretty much. We get to be on a lot of giving trees and pro-life baby showers, but I give everything to them, and luckily they process it and make the stores look lovely, so I'm very
And everything that you have is new.
Yes.
It's not a thrift store. Not that there's anything at all wrong with a thrift store.
Nope.
But the first time you explained that to me years ago, I was shocked by that.
When we had kids and we had 20 extra bucks, we might go and buy a cute little outfit for one of our kids. And they don't have a bill. They can't do that. Yeah. They just can't. So the coupons we sign, we give them 4 coupons for every class time. And that is about $20. And they can save them and buy big things, or they can shop at the moment. But everything is new. And they deserve that dignity.
Wow.
They deserve that dignity. So we're very blessed to have Christ Child help us. So everything is new at all the centers, and all 37 centers have a boutique, and they're all brand new. But we also have gently used because, let's face it, a mom might not be able to come to class. And so maybe she comes for an ultrasound and she can go to the free bin. We call it a free bin for lack of a better term. But they know it and they come right in and go right to there. So we use the gently used as well.
So you work with other not-for-profits like Christ Child Society, but then you have a whole system of donors.
Yes, I do. I am very blessed in Fort Wayne. Fort Wayne, even Ann Mannion, our volunteer president, will say Fort Wayne has been amazing from day one. Bishop Darcy arranged a luncheon for us when we were first coming to town, and amazing people came and made amazing gifts to get us off the ground, and many of them are still with us. But I have a donor list, and I send an appeal letter 4 times a year to that donor base, and they are good to respond. So I'm very blessed by that. We do have some family grants that are really important to us, private family grants. A lot of the granting organizations don't politically want to help.
Sure.
Yeah.
Sure.
But a few of the great families do.
And then you have a couple of big events, too, that are pretty famous.
Yeah. Yeah. Luxury Bingo. Yeah. It's coming up in August. That has been wonderful. Columbus, Ohio Center said they wanted to have a luxury bingo. And at the time, some of our leaders were like, what would that be about? Or how can that work? But has it ever worked? It's been great. I think last year it was about 1/4 of my income.
Wow.
So it was great.
I've been to this event, and it's not what you think.
No.
It's not in a church basement playing bingo with a bunch of little old ladies. It's quite the event.
Yeah. It's a lot of fun.
It is a lot of fun.
Yeah.
And you're surrounded by, well, of course, people that are interested in life and pregnancy, but there's a bigger feeling than that.
Yeah.
You're surrounded by, there's just this energy.
It is.
We're going to make a difference.
Yeah.
And this is a fun event, but we're here to make a difference.
Yeah, it is true. It's very fun.
Yeah.
And I'm very grateful for the people that come and help us have fun. So we're blessed.
You know, it seems like this might be a good time to pause. I want to show a video that I've seen, that I saw at Luxury Bingo, actually. But I want viewers to have a chance. And if you want me to stop it at some point and talk about it, we can. But I want viewers to have a chance to see this because I don't know where else they would find it.
Right.
So I'm going to play this video. I think you'll enjoy it. It's about 5 minutes. It is not a waste of your time, viewers, I promise. So please watch.
Before anything else, winning the big game, finding what brings you joy, graduating college, falling in love, leaving a legacy.
Life is good.
Before anything else, you have to be born.
Me, and it was meant for you.
And that's what you do, day after day. Hundreds and hundreds of moms and babies. Only life makes it possible. Whatever you do, whatever's been done, especially the impossible, before anything else, you help moms like Kaylee choose life. Kaylee was valedictorian of her high school, worked all through college. Then she became pregnant.
Knowing how I was raised and my parents being the ones to kind of turn their back on us, it just confused me. It was just a really tough, trying time. I was so hurt. They were definitely helicopter parents growing up. And then all of a sudden, they just wanted nothing to do with me. They thought I was going to get settled down, get financially stable, and then get married and then have a baby. But, God had other plans.
Jennifer had already scheduled her abortion appointment.
My husband is 65 years old, so I do understand where the hesitation was there and the fear, but then I also was thinking, well, wow, we've been together for 16 years. He's like, no, I don't want a baby, and so it really took me back because he's really a nice guy, and I was lost. I was depressed I couldn't share that too much with anybody because I'm the one in my family that's strong. I've never seen my husband that way. So on top of me worried about having a baby at 43 years old, I was also like, oh my God, this is a side of him I've never seen.
Once Madison found Women's Care Center, she attended over 100 parenting classes.
We came down this street and I saw the pink sign, and I was like, hey, free ultrasound and pregnancy, like we need to do that, like we should go there. And I went home and just looked this place up on Google and made an appointment.
And they kind of took over from there. With anything I needed, I kind of laid everything out to her. My life is in shambles. Allie, in summary, what do I do?
I was crying through my pregnancy. My daughter was even like, wow, Mom, I've never seen you cry. I've never seen you this broken.
Sorry. It was like, do I keep my baby and keep my marriage? But then I knew if I kept my marriage and lost my baby, I was losing my marriage anyway.
And then I was like, this is the green light to just start school. And so I started with summer semester, and it went really well.
We are back together once Maverick came, and we're doing really well.
We're in mother mode now. We're in hyperdrive. We just kept moving and kept going. They were always about just, you've got this. We're here now. Not the plan you had, but we're rolling with it.
We'll help you whatever you need. It's your decision, but whatever you need, we're here for you. And I decided to keep my baby. And everything that she said that she was going to do for me, she did, and much more.
I know that it would have been a harder route if this place wasn't here.
There are still good people in this world.
Whoever is out there that is anonymous and is given to the care center, and it has helped me.
Just seeing now my dad like so involved here at the center and seeing him so involved with my kids, it's just amazing to see that maybe it just took some adjustment time for them after all. You know, maybe it was just a shocker to them.
I never thought I would be the person that would be coming into that house. And exactly how it looks on the outside is exactly how it is on the inside.
You help every step of the way, building nurturing and self-sufficient families. You created the largest, most successful pregnancy resource center in the United States. You are with her from cradle to kindergarten.
Parenting is hard. Parenting is very hard, and it doesn't come with a manual.
You give them a chance at life. Before anything else, you and Women's Care Center.
That is a great video. I just love that. I could watch it 100 times.
I know.
Yeah.
I have, and I still cry.
You know, you remind me of a question I wanted to ask you, but, you know, after all of these years, you sort of answered it for me, but after all the years that you've done this, what could still touch you about this work?
Every single client that chooses life.
Yeah. Yeah.
Yeah.
It still gets you.
Yeah, it still does.
Yeah. Yeah. I've told, you know, in my office, when we've had an abortion-minded patient, and maybe I've had a student with me or a learner of some type,
Yeah.
and, you know, I'll tell them we're going to go in and we're going to talk about, you know, not destroying this baby. And, you know, they will come out, and the student invariably will say, well, you know, do you win these conversations all the time? And I say, no, we don't win. In fact, I don't know how many we win, but I know we win some number greater than 0.
Yeah.
And so whatever that number is, that's a huge victory.
Right, yeah.
But that will still get me going
Yeah.
after a long time.
Yeah, Mr. Pop called after we'd been open for a few weeks, and we had our first save. The first one that we knew was going to have her baby. And he said that day, 20 years ago, well, Anne, we did it. The rest is gravy. And he was right.
Right. Just saving one. But,
One.
You know,
yeah,
but
one.
what do you,
Infinite.
you know, you've mentioned Roe v. Wade a few times,
Yeah.
and now with the recent overturn with the Dobbs decision and such. I mean, it's an odd question, I guess, but what do you think the future of abortion looks like?
Oh, I wish what it would look like. But for us, the Dobbs proved to be a little tougher for us because the women tend to know they have no choice in Indiana, and so been a little harsher.
Yeah.
So a little harder.
But isn't that surprising? You would think this would be wonderful.
Yeah.
But actually, the table turned the other way.
It went the other way. So yeah. And then the Indiana legislation is wonderful. However, they're in a hurry. They got to get this done because they only have 6 weeks to make a decision. And,
Right.
So that didn't help a lot.
You
for
lose
us,
some of that
for our-
counseling space
yeah.
too.
Yeah, because we always say time is your best friend. You know.
It's interesting. That wasn't the intent of,
No, I know.
of
Not
the
at all.
legislators, I know, but what an unintended consequence.
Right. So yeah, they're in a bigger hurry. They're harsher, but they will still. They'll still, and that's why we're at 98%. They'll still accept that ultrasound.
Yeah.
And they'll accept returning for another ultrasound if we don't see what we expect to see or we don't see anything
sure.
yet. And that time is so valuable because it gives them time to think. Because panic is probably the number one for the women, for the states with no notification time.
Yeah.
A lot of babies are lost that way
Out
because
of
just
panic.
that one day,
Right.
just that 1 minute, coming back for that ultrasound. So the fear is always, well, it's not a baby yet, so I'll go ahead. So that's always
The
our fear.
dehumanization.
Right. But we tell them about an ectopic pregnancy.
Oh, sure.
If this would happen to be ectopic, an abortion won't solve that problem, and you'll be in serious medical danger.
And you've sent me several women through the years
Yes.
with an ectopic pregnancy.
And thank you
Yeah,
for
and that
seeing
could have
that
lost
way.
their life.
Yes.
And destroyed their fertility if
Right.
they didn't lose their life. But,
Right.
I think you touch on that. Now that traditional abortion is a little less available in a lot of states, about 20, I think, states now have so-called heartbeat laws where the abortion limit is lower and lower. There's still the medical abortion option, the pills, and now in many states it's available online.
Oh, yeah.
I posted a few months ago about some of the controversies in Georgia with some maternal deaths that occurred
Yes.
as a result of things that were being blamed on their heartbeat law, which it turns out was a bad story all around.
Right.
But yeah, I don't think that's going away.
No.
The internet
Right.
solves that problem.
Right.
So there'll always be a doctor in California willing to send a prescription to somebody in Indiana.
Yeah. And we've had a couple clients that have ordered them overseas from India.
Oh,
And I
right.
said, "What? Do you know what it is? Do you even know what's in that?"
Sure.
So we try and head them off at the pass, so to speak. With
But that's
the
another
dangers.
example of desperation.
Yeah,
I'm willing to take
absolutely.
a drug I have no idea what it is
Right.
because I'm so desperate.
Because I'm so desperate.
Yeah.
It
I like to say whenever I have the chance that being pro-life has to be so much more than being anti-abortion.
Right.
Because I think it's just, unless you're in this space like you are and I am from time to time, it's impossible to appreciate how devastating the circumstances could be that a right-thinking woman could think, this is my best choice.
Right.
And if we can't do something about that desperation,
Right.
then we'll never win this
Right.
this life argument.
Absolutely.
And also, I think, people like you and I are often accused of only caring about the babies
Yes.
and not caring about the moms.
Right.
And every time I hear that, I just want to punch the TV. I know you do too.
I do too.
Because nothing can be further from the truth.
Correct.
It is a cheap, false argument.
It is.
But your work is a great example of that just isn't true.
No, it isn't. And we say cradle to kindergarten all the time, so they remember that. But yeah, that is such an unfair assertion. It's been present forever.
But anyone could walk into a women's care center and just sit there and listen for 5 minutes and they would realize that's not how this goes.
Right. That's not how it goes.
I think another thing that would surprise viewers is this is not a religious position.
Right.
Now, it's a life position, and our views on life are very often formed by our religious positions and our religious teachings. But could you speak a little bit to that about not only is this not a Catholic organization per se, it's not really a religious organization.
It is not. And that is very important. There is a sense among our clients often, especially the 63% that aren't married, that, oh my goodness, I'm going to have a baby, I'm not married. And as old-fashioned as that is, or what the younger generation would call me old-fashioned about, it is a thing. It is a thing. And so they already feel maybe a danger of being judged by that.
I see, sure.
So we never have a religious conversation accept it their lead.
Right.
Now, if they say something that indicates that they'd like to talk about a faith perspective,
Yeah.
we're all good. We're all good to go there. But we would never lead with that, and we would never insinuate that until we know them, until they would say,
Yeah.
often they'll set up at the ultrasound table and say, oh, this is something, God is good. Or they'll give me little hints that I can, go forward. But until they do, we won't.
But it's important to point out, I think, you don't need a religious argument to advocate for life.
No.
It's very natural. It's in natural law.
Right.
This is a human.
Right.
And I like to say, and I've said recently in talks, the most ardent, sort of hard-hearted, convinced atheist would never advocate for exterminating 2-year-olds.
Right.
Because they would say society would be harmed by that.
Right.
But society is harmed by exterminating 2-month-olds inside their mother's womb.
Right. Who have we lost?
Yeah.
Who have we lost
That we'll never
would
know.
have changed something really important in this world?
Hundreds and hundreds of thousands.
Yes.
Yeah.
Yeah, millions.
Yeah.
Yeah.
Yeah, that's
it's amazing.
remarkable.
Yeah.
But to the point, we don't have to preach. We don't have to use a religious position. We can, but I almost think it's a stronger position when we don't have to.
Right, I agree. And St. Francis said, preach often, use words if necessary. So that's what we give them diapers. That says how we care, if that's their issue right then.
Well, as we wrap up, what do you think viewers would be most surprised to learn about the Women's Care Center?
Wow. I think the nature of the work in terms of looking like a living room when they walk in, no reception desk, we don't wear scrubs. I think they would be surprised a little bit that it's not a more medical looking facility. I think they'd be surprised that we will take on the abortion issue with them, that we're going to give them the information because they're thinking that. And we want to make sure they know what that means for them. So they'd probably be surprised. Every now and then someone will call a possible donor or maybe even a donor and be upset with our client page, our internet client page, because it'll say abortion information.
Oh, I see.
And they'll, why are you giving abortion information? I said, because they want to have an abortion and they need to know what that really means for them.
But it's interesting. That's called informed consent in medicine. And if you just consent to something without information, it's just consent. It's not informed consent.
Right.
But if you don't understand what you're saying yes to, I mean, part of that understanding has to be an understanding of what you're saying no to.
Right.
Whether if you're thinking about surgery for cancer versus not surgery for cancer, you've got to understand both sides.
Right.
So all you're doing is giving authentic, real information.
Right.
Wow.
So I think people would be surprised by that we even talk about abortion at all.
I think you're exactly right.
Yeah.
I'll bet there's a lot of viewers that are watching this that are thinking, wow, I'm moved by this Anne Koehl woman. How do I support the Women's Care Center? What do I do?
Oh, call me and I'll tell them for sure. Financially, it's we're doing okay. I usually get to the end of the year and have $1,000 or so left. I don't. Ann Mannion has been an amazing leader. So we have one central office in South Bend for all of us. So I don't have to worry about insurance. I don't have to worry about benefits. I don't have to worry about payroll.
Right.
And that's been such a smart move because all the directors and all 37 centers can concentrate on client care. And she never turns me down if I need something. But I know probably sometimes I've asked for too much for the budget.
But if a convicted viewer, I mean convicted in the sense of their heart, if they right now want to give money to Women's Care Center, how do they do it?
They can write a check and send it to 4600 West Jefferson Boulevard. They can go online to womenscarecenter.org.
And we'll include that in the program notes. But there is a donate button. It's very easy to do.
Yeah. They can come to Luxury Bingo and have a lot of fun.
Meet some great people.
Yeah, right. So there's a lot of ways to help. But financially, as much as I appreciate my volunteers I have, it's the light bill and the ultrasound tape, the film, and, it's those things.
Wow.
So.
Well, I get to meet in my role a lot of amazing people that do a lot of amazing things. But I have to say, with all of our viewers as a witness, you are among the most amazing.
Oh, no.
And, it's someday when you're standing in judgment, they're going to say, Thank you for all the lives that you touched and that you saved.
You're so kind.
There are people walking around this earth right now doing great things. They wouldn't be here
Oh.
if it weren't for you. So
You're
God
very
bless you,
kind.
and thank you for your work.
You. And thank you. You read our ultrasounds. Mary Ann comes and sees our clients. Really, honestly, thank you so much.
Great. Thanks for
all
being
you
with
do.
us.
Yeah, I'm happy to be here.
Well, I hope you've enjoyed this episode of All Things Women's Health as much as we've enjoyed bringing it to you. I hope that you've learned more about this amazing organization, the Women's Care Center. Mostly, I hope that maybe I've encouraged you to go onto their website and make a donation. No donation is too large, and assures me, so don't be shy about that. And don't donate once. Become a recurring supporter of this amazing organization. I know a lot of times we're worried that will our donation dollars actually make a difference? I can tell you from my own personal experience that a dollar given to the Women's Care Center will be a dollar that goes towards saving, changing, transforming a life. There's not a better place that you could put your donation dollars. So look them up and become a supporter. I hope, again, that you've enjoyed it. I hope that you'll share this with everyone that you know. Please like and subscribe. It helps us bring more content like this to you. If there are things that you'd like to hear about, I'd love to know. If there are things you'd like to share with me about this episode, I'd like to know those too. I'll be back again soon with another episode of All Things Women's Health.